Could you tell us what the Hyde Amendment as it currently stands does?
Hyde Amendment basically says no public funding for abortion. None of our taxpayer money goes for abortion or pays for insurance policies that cover abortion. The only exception to that rule is if it saved life of a mother or rape or incest. Other than that, no public funding for abortion. And that's really what the Hyde Amendment says.
And it lasts as long as each year's annual appropriation lasts.
Correct. The federal government through Medicaid, Medicare, Defense Department, we provide health care, even federal employees. So every year we stick the Hyde Amendment, as you said, in the Health and Human Services, HHS, Labor Appropriations Bill, and other bills, Foreign Service, Foreign Operations Bill, Department of Defense Bill. We put in there no public funds, no taxpayer money can be used for abortions.
As long as the money's actually being appropriated by that particular piece of legislation.
Correct.
So if it's outside of that particular piece of legislation, then it's not affected by the Hyde Amendment.
Correct, but the Hyde Amendment applies everywhere. We have it in Indian Health Services.
Mm-hmm.
We have in the State Children's Health Initiative program. There is no public dollars going in support of or for insurance policies that provide reproductive rights or abortion, in other words.
As of right now.
As of right now.
As of this moment, no federal money goes directly or indirectly to fund abortion, except in cases of rape, incest, and a threat to the life of the mother.
As of right now, that is a correct statement.
Okay. Now, will the Hyde Amendment, such as it now exists, apply to the new health care reform bill that's being considered?
No, it will not. I offered the Hyde Amendment along with Joe Pitts from Pennsylvania in committee. I said, as you said, on the Energy and Commerce Committee, we have the main jurisdiction over the policy part of healthcare. The tax part is Ways and Means, and Education, Labor had a little part, but we're the main committee for health in the U.S. House of Representatives. And in that committee, I offered the Hyde Amendment. Straight language we've always had since about 1970s. Said maintain current law in this act, for creating national health care program. In this act, there shall be no public funds, federal funds, for abortion. We lost that amendment 31 to 29. We lost by 2 votes.
Question on health care, actually. 2 questions. First, in a letter to senators last week, the U.S. Conference of Catholic Bishops said that, I'm quoting, so far the health reform bills considered in the committee, including the new Senate Finance Committee bill, have not met the President's challenge of barring use of federal dollars for abortion. Is that statement wrong?
Well, I don't want to get me in trouble at church, but I would mention there's a law that precludes the use of federal funds for abortion that isn't going to be changed in these health care bills.
There have been several amendments that would explicitly bar abortions that were rejected. Some of those amendments by Democrats.
There's a fairly well documented federal law that prevents it.
About this issue on Wednesday, the Catholic bishops have sent out another letter yesterday, in which sent another letter to Congress. And you said on Wednesday that the Hyde Amendment would prevent abortion funding through the health bill. The Catholic bishops have repeatedly said that the Hyde Amendment would not apply to the health care bill. And yesterday, in the letter that they sent to Congress, they said that if language expressly prohibiting abortion funding is not added to the health care bill, they will vigorously oppose, that's a quote, the bill. My question on that, does the President support the bishops on this? And to eliminate this as an issue, will he call on Congress to have an explicit prohibition of abortion funding?
You know, my answer isn't different than it was on Wednesday. There may be a legal interpretation that has been lost here, but there's a fairly clear federal law prohibiting the federal use of money for abortion. I think it is, again, it's exceedingly clear in the law.
But the Hyde Amendment is only for direct appropriations for HHS, and that's...
again, I think that law is exceedingly clear.
I just want to revisit an issue from last week. Congressman Bart Stupak has talked about possibly holding up the bill unless there's highlight. Yeah,
I know, yeah, but he asked this question twice last week, so we're on like.
This is a different question. This is a different question.
I'm sure it is.
If highlight language is already in the bill, would there be any reason for Democrats not to support this language if it's I
have not seen what Congressman Stupak said most recently. I would refer you to the answers I gave you on this question just twice last week.
When President Obama came and spoke to the joint session of
Correct.
Congress on September 9th, he said, quote, "And one more misunderstanding I want to clear up. Under our plan, no federal dollars will be used to fund abortions," unquote. Is that a true or false statement?
That's exactly what he said.
Okay, that's what he said, but is it an accurate statement?
I called him. I called the president, had a discussion with the president, and I read exactly what you just said. And he said, what it says is, under my plan, being the president's plan. And I'd say, with all due respect, sir, you do not have a plan. The only plan we have out is the House plan. So I don't know if it's a game of semantics or what.
And one more misunderstanding I want to clear up. Under our plan, no federal dollars will be used to fund abortions.
So President Obama did not tell you, Congressman Stupak, that the plans that have been drafted in the House, the bill that actually came out of your committee, does not fund abortion.
He did not say that.
He didn't assert that. He said that his plan,
His plan,
theoretically some different plan than the one you actually drafted
correct,
in the committee.
correct. And when I pointed this out, he said, go back and work with the people in your committee and get this matter worked out. Work with the speaker. Work with us, would you? And I said, yes, I would. And we have tried. But we haven't been able to resolve our differences because we do not want public funds going for abortion.
Did President Obama indicate to you that he supports your amendment?
He is supportive of what I'm trying to do. However, we're getting down to crunch time. And I would call upon the president to help us out here. The speaker has told me I will not have my amendment. It will not be made in order. It will not be part of 3200. So it caps the language, which citizens will have to start using their funds, public funds, to pay for abortions, will be part of 3200. And I will not have an opportunity on the House floor to delete that language or to put the hide language in there to supersede the caps.
So the president has represented to you that he supports the goal
Yes.
of prohibiting federal dollars from being used to buy insurance that covers abortion.
Yes,
Without saying he supports the specific language of your amendment.
without saying he supports my specific language.
Second question, and I would just ask that you let me complete the question first. That is, Representative Stupak.
Interesting concept, but go ahead. Yes.
Well, last time you did, so.
No, the last 3 times. But go ahead. I'm saying I couldn't do it. 4. Go ahead. I'm sorry.
All right. Congressman Stupak has said that he has 40 Democrats to kill the health bill in the House if his amendment to bar abortion funding doesn't get a vote. And he said that he has personally asked the White House to intervene and ask Speaker Pelosi to call for a vote on this amendment. Will the president do that?
I will see if there's any update from legislative affairs on that. I know that the president's position on this has been clear, that no federal money should be used to pay for abortions in a health care bill.
But Congressman Stupak, in an interview, he said that in a conversation he had with the president, that the president told him he wasn't referring to the House bill, H.R. 3200. He was referring to his own vision of the health care bill.
I can go back and see if I get any more clarity on that conversation. I do know obviously they did talk about this as when Congressman Stupak was here. I will we'll get some guidance from legislative affairs.